Right. So carrying forward what we've been discussing all through is that we're going into a kind of a phase. I hope it's a phase, or it may be just a different era where we deal with a lot of patients who are much more aggressive, with a lot of very, very sad and disturbing news about doctors getting assaulted in spite of their best efforts. And that has not changed, even though people and doctors are laying down their lives for patients in this COVID war. But in spite of that, there's a lot of, you know, situations we hear about where there is a doctor or staff who's been assaulted, or hospitals and clinics which have been damaged or broken. And of course, none of us want to be in that situation. The best way would be to prevent it, but it's not always possible. So I will just run through what we do, in our clinic, in our hospital, small things which may help. So one of the first things is to try and address it before it escalates. So how do we know to address it? So the aggressive patient can be of two different kinds. One is, of course, there could be the very obvious one where they are physical, or actually breaking things, and that's, of course, doesn't need any sort of tip out. But it could also be someone very subtle changes in their body language or their behavior. So a change in their voice, the way they sit, pacing around, or facial expressions could be the first indication that a person may be getting uncomfortable or aggressive. And sometimes it may not even be in your own chamber, it could be in the reception or waiting area. So it's very important that everyone, even outside, including your staff, are trained to try and pick this up. So it could be very, very subtle changes, and it's a good idea to be aware. So what are the communication strategies in dealing with these difficult patients? Of course, they can be quite malevolent. The important part is for the health professional to still try and remain respectful and professional. It's not always possible, of course, when it actually becomes a physical violence, but we should try and remain, try and keep boundaries. But above all, we have to try and remember that safety first. And with these very, very horrible situations where people are getting physically violent, I think the first thing is to try and keep our healthcare professionals safe. So when a patient is getting angry, the first thing, and we do see, patients who would be unhappy about different things, and that could be across a different range of problems. But they would sort of take a cue from our body language and our voice. So if you keep your tone of voice much lower, try not to raise, even if they are shouting, if you try to keep your tone down, very often the situation can be calmed down. The body language is extremely important. So we won't go into exactly what the body language, but try, to have a very open kind of communication rather than a very defensive or an angry stance. Acknowledge the patient's anger. So it sometimes may be justified, sometimes not, or it may not be correlate to the severity. So it might be something very trivial, but they have got very angry. So, but it's still important that we acknowledge that there is a reason, if there is, and we could, of course, bring it up that they seem uncomfortable, and if there's any way we can help. But that could also be counterproductive. So if you try to tell them that they are losing their cool, they might get further aggressive. So it's a fine line there. Of course, it's important for us to try and understand why they're angry. And it says that sometimes, they may show it as anger, but it could be other things, especially if we're working in a more a systemic hospital, multi-speciality hospital, where people are dealing with, say, death or a chronic illness. Then those kind of things are very, very important, because they might be dealing with very, very important issues. Of course, again, even in our ophthalmology setting, sometimes there may be something very serious which they are dealing with, and that could be manifesting as the anger. That is, of course, the best case scenario where there's actually a reason, but unfortunately, we know that sometimes there can be no reason and they might still be very aggressive. So if the error has occurred, of course, we can apologize, but sometimes even without any error, it could still go out of hand. So we always take the time to listen. Best idea is to try, and if there is a mob kind of situation, is to try and get as many people from your own institute along with you to try and safeguard the situation. When someone is already angry, it's better to avoid trying to get angry yourself, or if they're very abusive, it's a good idea to remove yourself from that situation. And definitely, if there's any threat of a physical harm, then we should remove ourselves and prioritize safety. So in that case, it's a good idea to have, if you sense that the situation is going out of hand, to bring yourself closer to the exit. But of course, all of this works only for verbal violence and not for physical violence. When it's an angry mob, there's really no arguing with them or no trying to explain anything. And at that point, it becomes your security first. There's no reasoning with the mob. And for this, of course, having some sort of security is essential. We may not always have a huge security force, and we do know that the security guards who work in a hospital or in such situations are not really the strongest people there, and they may not be able to stop an angry mob. But the idea is to try and prevent escalation. So as I was saying, you train your front office and support staff to pick it up. Notices about CCTV coverage are very important. They work as a deterrent. So they can be put up prominently if you have this facility, and notices saying that also that if violence is punishable. Good security officers also help, but a good relation with your local police force may also help, because then they could come in, short notice if there was ever a requirement. Also, having a good communication with ophthalmologists around you or doctors around you, because you never know when you may need to help someone, or they may need your help, or you may need their help. So it's a good idea to have that communication going with everyone. So with that, I will end my talk.